Introducing the Ambu Action Pain Pump, post-surgical pain relief exactly where you need it. Your doctor has prescribed the Ambu Action Pump Pain Relief System to help manage your post-surgical pain for up to 3 days. Using the Ambu Action Pump System, you will experience better pain relief and comfort during recovery, have less need for narcotics, return to your normal activities more quickly, experience less grogginess, have greater mobility and ambulation, be discharged from the hospital earlier, and avoid many surgical side effects such as nausea, vomiting, constipation, and addiction. The pump delivers a local anesthetic, meaning only the areas where you feel pain are targeted. Local anesthetics are medications similar to the Novocaine that you might get at a dentist's office. The Action Pump is a balloon-type pump with a regulator that is connected to a small catheter or tube which is inserted by your doctor. The balloon-like reservoir holds the local anesthetic. The fill port is used by your physician to fill the reservoir. Leave this port capped at all times. The regulator determines the quantity of anesthetic deployed each hour. This tightly woven filter will not allow any air, particulate matter, or foreign microorganisms to pass through, ensuring you always receive sterile medication. This Luer lock connection joins the entire system to the catheter. To ensure this remains tightly engaged, avoid interacting with it as much as possible. The transparent dressing on top of the catheter at your block site will remain until your physician directs otherwise. Some physicians prefer to perform the removal of this dressing themselves. If you have any issues or concerns about your pain pump device, please call 1-800-395-2890, 24 hours a day, 7 days a week. Depending on your procedure, the catheter will be placed by your doctor either near the incision site or next to a nerve leading to the surgical area. The Action Pump will automatically and continuously release medicine at a slow and steady rate to help reduce your pain after surgery. This drip is similar to irrigation tubing in your garden. You may not notice the flow of medication at first. Avoid touching or removing the dressing over the catheter site, as it could dislodge the catheter. Place the reservoir and regulator assembly back into the carrying pouch. Once the device is secure in the carrying pouch, check the white clamps to ensure they are fully hyperextended. The Action Pump delivers your medication very slowly. It may take up to 24 hours after your procedure to notice a change in the size of the pump. Rest assured, the pump will gradually deflate as it releases medicine over a number of days. The pump's appearance may vary depending on the size and flow rate of your pump. If at any point during recovery your pain scale is unmanageable, dial 1-800-395-2890 for troubleshooting and assistance. Ensure there are no kinks or twists in tubing. Do not use tape near any part of the tubing. If you are using ice or cold therapy, keep it away from the pump, tubing, and block site. The Action Pain Pump is portable and designed to fit into the provided pouch for ease of carrying. This bag is for both security and convenience, allowing you to get back to your routine sooner. The pump and regulator should be worn outside of your clothing at all times. The components may be assessed via the view window on the back of the carrying pouch. When is my pump empty? Depending on size of pump, it may take 2 to 5 days to fully deflate. What should I do while sleeping? Place the pump and pouch on a bedside table or on top of the covers. Do not place the pump under the covers or clothing where it may become too warm. Do not place on the floor or hang above the bed. What should I do while bathing? Follow your doctor's directions on when it is okay to take a shower. Take care to protect the catheter site, pump, and filter from the water. Do not submerge the pump in water. What should I do in case of an emergency? Call your doctor immediately. If after hours, dial emergency services for your area. You may experience numbness and loss of feeling in the treated area. This is normal, though you should pay attention to changes in sensation during treatment. It's time to close the clamp and call your doctor if you experience an increase in pain, fevers, chills or sweats, bowel or bladder changes, difficulty breathing, redness, warmth or discharge from the catheter site, pain, swelling or dizziness, blurred vision, ringing in the ears or the taste of metal, numbness of digits or mouth, drowsiness and confusion, or if the catheter accidentally becomes disconnected. If any of these occur, call 911 or your doctor immediately. Post-op pain relief from Ambu.